All right, so as you can imagine, after surgery, you're going to be very sore and it can be difficult to get out of a bed or a chair wherever you're recovering. It is really helpful for the caregiver to be able to assist in this process to make sure to not put any strain on the surgical site. So we're going to demonstrate with Megan here, my patient, how to get out of a bed from a surgery when she's had a tummy tuck. As you can see, she is resting with an incline at about 30 degrees to make sure that she always has that bend when she is sleeping. So when we're going to do this, you need to do it in a stepwise approach for safety and to make sure she's as comfortable as possible. So Megan, what we're going to do first is I'm going to go ahead and take off the blanket and we're going to move your feet so that way they are touching the floor and we are sitting on the bed first. So I'm going to take your arms. It is important that Megan uses her muscles from her chest or her legs and not from her abdomen. However, sometimes you might get a surgery where you have those other areas operated on as well. So the whole goal is to make sure that you are not using any area that has been operated on. All right, so what we're gonna do is go ahead and move your legs so they're sitting on the floor, and I'm going to help support your back. It is important to get up after surgery to reduce the risk of blood clots and to get up and move around. So you'll want to do this whenever they have to go to the bathroom, but also to get up and get a drink of water or just do a little lap around the house. All right, so first, as you can see, Megan has her feet planted firmly on the floor. We want to stay here in this position for a little while just to make sure that she's not feeling lightheaded after surgery. When you have surgery, you're on pain medication, you're dehydrated, so it is common to feel lightheaded in this position. Are you feeling ready to stand? Okay, so I'm going to go ahead and support her as she gets to a standing position, but take note that she is maintaining a sloppy posture or a bend in her abdomen. This is because we cannot put strain on the abdominal position for 1 week after surgery. We're going to go ahead and walk in this position. Are you ready? Okay. We're going to slowly move to where we need to go. And as you can see, this can put a lot of strain on your lower back. So make sure if you do have the opportunity to always use a caregiver, a walker or a cane to offload that pressure if you need, while still maintaining this bend wherever you need to go. We're going to move back to the bed now, okay? Right. First, we're going to sit back down. You feel comfortable? You have two options here. Because we need to offload from the abdomen, she can either hug a pillow to her chest to remove pressure in that way, or she can just do it without a pillow. I'm going to go ahead and take this off, but I wanted to demonstrate that. I'm going to support her back while she swings her legs back into bed. You ready? Okay, go ahead. Nice and slow. She can use her arm if she needs to because she did not get surgery on her chest. You feel comfortable? All right. And that is how you move from the bed with a tummy tuck. Okay, so now we're going to demonstrate how to get up after a tummy tuck if you are recovering in a recliner instead of a bed. So when you're recovering in a recliner, it is still important to not lie all the way flat to make sure that you're offloading pressure from your incision, and to use a caregiver if you can to help you through this process. Whenever you're getting up from a seated position, you're always going to want to make sure whatever surgery you're getting done that you are not putting strain on the muscle groups that were operated on. So having help is really important. We do want you to get up and move around after surgery because it does help to reduce the risk of blood clots, as well as allows you to get up and go to the bathroom and get a drink of water. All right, so we are going to do this cautiously and in a stepwise approach because, as you can imagine, Megan after surgery is pretty sore and she can be lightheaded because of the use of pain medications and dehydration and anything that can cause her some dizziness. So go ahead, Megan. I'm going to help you, and you're going to scooch to the edge of the seat here until her feet are planted firmly on the floor. We're going to sit in this position for a little while just to make sure that she is safe and comfortable and she is not dizzy. Do you feel ready to stand? Yes. Perfect. So then I'm going to support her in any way she needs to help her to stand. If something's uncomfortable, she needs to communicate that just to make sure that you're not putting any added strain on the area. Okay, ready? Go ahead. So with my help, she's able to stand. And as you can see, when I turn her, She is maintaining that sloppy posture or angled position that you do need after a tummy tuck to make sure that you are not putting any strain on your incision. As you can imagine, this can put some pressure on your lower back or cause lower back pain, so do make sure that you have a caregiver to help you with this, or to use a walker or cane at home if you have them. So, because we did demonstrate in the previous clip how to walk around after, we're just going to go ahead and sit back down. So make sure that she backs up until her legs touch the recliner, so she knows where it is, and then with your support, she's going to go ahead and lay back. First sit, of course, and then I'm going to help her with this part so she's not using her abdominal muscles. Okay, go ahead and scooch, and then lay on back. Perfect.